Hello there, my name's Mark. I'm about to head off to Mexico to see the dentist. My teeth are destroyed from years of teeth grinding through TMJ issue, and I've been quoted from American dentists for somewhere between $50,000 and $60,000, which I don't have, and medical insurance is $1,000 a year. Dental insurance is $1,000, so I'm looking forward to seeing what he can do and whether my teeth can get repaired for somewhat less than a house down payment. I'm trepidatious, but looking forward to seeing what we find out.
And have you ever been to Mexico?
I haven't been to Mexico before. I've been to many other countries. I'm actually Australian by birth, but I've been to Mexico. Looking forward to it.
Okay. So do you have any anticipation of what it's going to be like? I mean, are you nervous or?
I'm curious to see the difference. I've been to third world countries before, and I'm curious to see the difference between very bad third world countries and what I've heard in the media and from friends about what Mexico is actually like, especially just across the border. So I have many preconceived ideas which don't make sense combined together. So I'm looking forward to seeing what that actually turns out to be.
Okay, great. We can't wait to hear what you think when you get back. We just have a seat.
I think I need to use the restroom.
Okay. Jorge, ¿Cancería?
Kelly?
Sí.
What's your name?
Amy.
Okay, give me a second.
Thank you.
She's coming with you.
Sí.
Do you want a water, coffee?
No, thank you.
Hi, new patients? You and you. Okay.
They've already filled out the forms.
You already filled the
They
form?
did, yes.
Okay, so who has them?
We brought a copy right here.
Oh, great.
They're in the files.
Okay, this is the one is yours and one
Nope, these are for them patients.
Okay, that's it. Thank you.
Okay, so we have a money issue, and we have a problem that's been going on since you were 16.
Yeah, so 20-some years.
Do you have any pain right now?
No, I had I had an extraction last week and 3 root canals done because I had an infection on this side.
Okay.
But I can afford to have.
You had root canals done?
Yeah, I can afford to have the root canals finished, and then that's my insurance done for the year.
Because I don't see any root canal in here.
Here, and here. No caps, no. It's just the root canal.
They just cleaned the.
Yeah, and.
Okay, so what else? I'm just trying to get the big picture here. So.
Procedure, I'm not worried about. I have a high pain tolerance. My questions about being here is I have a wife and family and a job, back in Los Angeles. So it's how to make that work, how to make finances work. The being here, everything Amy said and what I've seen just now, I'm kosher with that. That's all okay.
Oh, that's good.
How
you need to feel okay
the
with all
logistics.
this.
Also, I have more fear about.
Oh, try not to worry about that, because basically what we're trying to do is make it work for you, so you can have the treatment that you need, and not something that's going to be temporary. When you come out, well, actually, when you come out of this clinic with your treatment finished, it's something that I want for you to have for at least 20 years. Okay, it's not something that it's gonna break off in 5 years. We don't do that kind of work. Okay, we're totally against it. Anything else I should know?
No.
Any systemic disease, Mark?
No.
Diabetes, high blood pressure.
I have low blood pressure.
Low blood pressure. So the other way around.
Health-wise, I'm perfect apart from my teeth. I've never had anything. I've never been admitted to hospital.
Okay.
The only thing I've been to a doctor for in the last 15 years is headaches because of the TMJ. So it's like, this is it.
What kind of mouth do you visualize?
If I walk away from this with serviceable teeth, like if you say 20 years, that's right now I'm looking at, nothing in the next 5 years, and
Okay.
dentures for the rest of my life until my jaw gives up, and then I have to get an artificial jaw. So,
Now, why have you been losing teeth? Because of cavities or because of mobility? Or they just cracked or an accident?
Literally breaking them in my sleep, waking up with pieces of tooth in my mouth.
Okay, so this is what we're gonna do. I think, if it's okay with the both of us. First of all, we cannot go with with final solutions because we need to take care of your bite.
Yeah.
Okay. If I put porcelain, you're gonna break it.
Yeah.
If I put composite, you're gonna break it. If I put a bridge, you're gonna break it. If I put a removable prosthesis, you're gonna break it. So first of all, instead of going with the, let's say, the gold and porcelain or only porcelain materials, first of all, we're gonna go with plastics. Okay. Why? At first, you're gonna look as if they're porcelain. Okay. That's the most beautiful thing there is. The bad part is they don't last that long, looking beautiful. But we don't need that much time, okay? What we want is to get sort of say, an essay of what's gonna be the definite solution.
Yeah.
Okay, but in the meantime, we're gonna be working with those plastic teeth, and that's gonna help to relax your whole muscle, okay? And after that's done, we can go and put the definite restorations over there.
Yeah.
There's something very simple going on over here. You've lost teeth, a few of them, okay? And in the meantime, your whole system has been trying to find a way to make it work, just like that.
Yeah.
So now, we have your brain, and we have your mouth. And your mouth got adjusted, and then it told the brain, you know what, this is how we're gonna work, so cope with it.
Yeah.
And now the brain, after so much time, is saying, yeah, that's the way it has to work. So if we try to make it perfect, just like that,
Yeah.
the brain is gonna say, you know what, this is different, this is not good, we gotta find the way we were biting before. That's when you're gonna be breaking everything that we put, because the muscles are gonna go stronger, you're gonna be grinding faster,
Right.
and everything's gonna go to hell, okay? What we need, first of all, is to disconnect your brain from your mouth, so it doesn't know what's going on,
Right.
it doesn't remember your mouth, and after a while, after we've relaxed the jaw, we relax your muscles, we relax the tongue, we relax the cheeks, and in that same part, we relax the teeth, okay? When that happens, we can connect again with the brain, sort of say, so it's gonna, so the brain now is gonna go like, oh, okay, so how were we biting? We were biting like this, and it's just gonna say, oh, okay, so let's go with that. And that way you'll stay with the definite work, the definite dental job, and you'll be good with it. I don't know if I'm clear with this. So,
One question.
Yeah.
You mean you're going to separate the brain by using plastic,
exactly.
not by cutting?
No, not by. I have scissors, but I don't do that. Okay.
No neurosurgery. Okay.
No, that's nothing like that. It's very simple techniques, very simple protocols, but they work wonders. Okay. There are people that actually cannot even open their mouth. They come like this and, doctor, it hurts. We take a little bit of plastic, we put it in the mouth, but it's, of course, you have to know the technique. We put it in there when they can only open like this. And in about 4 days, pain is gone, they're relaxed, they can open like this. We put something bigger, and then in about 2 weeks, they go like this. That's when we put a bigger plastic in there, which is what we can do with you now. And after everything's relaxed, then we keep going with the dental work. So any questions, any doubts?
Where's your magic wand? Bring it up.
You're gonna have the magic one, but it's, again, this is a team effort,
Yeah.
okay?
If anything, he was too easy on me. I kind of felt like I could send my 2-year-old son to this guy and not worry about him getting hurt. Like, it was really gentle. Yeah, just a different style. If anything, you know, like, he was too much of a perfectionist, which, you know, I hate people being perfect on my mouth. So that's all a good thing.